If you had a knee replacement and you're thinking about getting back to the gym, this is where most people get it wrong. I see it all the time as a physio. People finish their rehab, they get cleared by their surgeon or physio, 3 to 6 months pass, the knee feels okay, and then the big question hits. Can I lift weights? Is it safe? What exercises should I do in the gym and which exercise should I avoid? Because the last thing you want is to go through all that surgery, rehab, only to mess it up in the gym. Hey guys, I'm Alex. I'm a physiotherapist with over 21 years experience in private practice. And this is Gavin, experienced personal trainer with over 13 years experience working with people over 40.
And we've actually worked with countless knee replacement patients and clients who want to get back to training safely and confidently. And here's the truth. Not only is it safe to return back to the gym, it's absolutely necessary, but only if you choose the right exercises. In this video, we're going to show you 3 must-do exercises to rebuild strength and protect your new knee, and 3 common exercises you should avoid, well, at least for now, if you want your knee to last. So first of all, we're going to cover what are the exercises you can do, all right? So I'm going to chunk the first one into more of a movement pattern, and it's a deadlift pattern. So when you think deadlifts, a lot of people will think massive heavy weights, okay? And that's not what we want to do here. The movement pattern itself is really, really functional, and you're going to do it every single day when you lift things up off the floor, right? And the nature of this exercise is really great because it doesn't make your knee bend too far, and a lot of the load goes into the glute because we know that the glute will ultimately support the knee as well. And you can load this up really nicely, and you can start nice and gentle, and you can build up over time. So we're going to get Alex to demonstrate this deadlift pattern or drop squat or whatever you're going to do, right? So Alex is going to stand over the kettlebell. If you just turn a little bit that way, okay, and then come over the top. And his feet are going to be either side, and his center of gravity is going to be right over the top of this kettlebell. This is really important because it keeps your back nice and safe. So Alex is going to just drop his hands down in between his legs that way till his forearms are touching the inside of his knee. And he's going to drop his hips down a bit further, and he's going to grab that kettlebell. Now, as you can see with Alex, he's got a really nice straight back. His legs are at a nice angle of probably, 45 degrees. And a lot of the load now is in his legs and his glutes and his lower back. He's going to stand up off the floor. He's standing nice and tall. He's going to push his hips forward, stand up tall. He's going to reverse that movement. So his hips are going to go back towards the back of the room. He's going to let that weight drop downwards, okay? His elbows are going to touch his knees, and he's going to come straight back up. It's not necessary that he has to touch the floor with this exercise. So as he does it again, what I find is as soon as the forearms touch the inside of the knee, right there, he can stand straight back up, and you're going to get that done. If obviously you've got a bit more mobility, you can go to the floor, but I find it to start off this a little bit easier. So Alex can stop doing that for a second. And in terms of reps and sets, okay, we want to be doing about 12 to 15 good quality reps at that speed. So he's not rushing this exercise. And when you do 12 to 15 reps, the last one needs to be challenging. You're going to rest for about 30 seconds, and you're going to repeat that 2 more times, all right?
The really good thing about doing this exercise after a knee replacement, so it may not be in the first few weeks, but a little bit further down the track, is that a lot of people after a knee replacement, they struggle with getting the knee bend, okay? So for this exercise, you actually don't need a lot of knee bend to be able to do it. So even if you're limited to, say, 90 degrees, you should still be able to do deadlifts quite comfortably.
All right then, so the next exercise we got is more of a step-up exercise. It's a unilateral exercise. You work in individual legs at the same time. And what this is going to do is going to really help that knee start to take its own load on, because we know that people will sort of bias their good leg and not work the other leg, right? So Alex is going to step up in front of this box this way, and he's going to put his right leg onto the box. And what I want him to do is look forward into the corner of that room there, and he's going to lean forward and put all the weight onto his quad, and he's going to stand up straight up off the step and lower it gently back down to the floor. And this is the important bit. It's the control on the way down, which is absolutely key for you, right? Now, the good thing about this exercise, we can have a higher step or even a lower step. So if, let's just say, that's causing a bit too much pain, we got a makeshift step there with 2 plates. Exactly the same thing. So put your foot on, lean forward, and then stand up off there. So the good thing about this is you can have small steps or big steps and whatever else and stem back down. Again, you're looking at about 12 to 15 reps per leg take a rest for 30 seconds and repeat the process as you go. All right, so the last exercise that you can do really safely is a calf raise, all right? I'm gonna give you two options for this. So first of all, Alex is gonna put both of his feet on that, on the plates. And what you're gonna do, you're gonna put something in front of you. It could be against the wall, it doesn't matter. It's just to support you, all right? So Alex is gonna drop both of his heels to the floor, and then he's gonna extend his ankles and calf raise himself right up and really squeeze the calf muscles at the back and slowly load it again. Notice though that we're going nice and slow. It's about 1 second up and then maybe 2 or 3 seconds on the lowering portion. And this is going to help support the knee as well. Now, if this is too easy, what we can do is Alex can wrap one leg behind the other one, and then you can do single leg calf raises that way, okay? But I wouldn't recommend this at the beginning. This is something you can progress into over the course of your rehab. So they're the 3 exercises that you can do relatively quickly after your knee replacement. And by the way, we've got a free guide that if you want a copy of that, it hits all 5 exercises that we recommend to our clients in the gym and our practice. And if you'd like a copy of that guide, just comment knees down below and we'll send that over to you.
All right, and now we're going to cover the 3 types of exercises that you should avoid after a knee replacement, specifically when it comes to gym exercises. So the first type of exercise is what we call plyometrics. Okay, so plyometrics just means fast, high velocity, high impact kind of movements. Okay, so like box jumps or lunge jumps. Running is actually another example. This is the question that I get asked a lot by my patients: can I run again after knee replacement? So very often you're physically able to. Okay, so you're physically able to run, but most surgeons, most physios will actually tell you it's not advisable. Now, why is it not advisable? And it's because of the high impact. It will speed up the wear and tear of your prosthetic, of your new knee joint. So instead of lasting the normal 15 to 20 years, it may only last 10 years. Okay, so it's not, again, at the end of the day, it's your call, but it is generally not a good idea to get involved with any sort of high impact plyometric type exercises. So the second type of exercise that you should avoid in the gym after a knee replacement is deep squats. And I want to make it clear, so normal squats are okay as long as they stay relatively shallow. So it's generally not a good idea to be going past 90 degrees off your knee. So 90 degrees looks like this, okay? So that's 90 degrees. So if you're trying to squat, generally speaking, if you go to about this point here, you are relatively safe. But if you try to go kind of get your butt right down onto your heels, if you try to do that, you probably find it, first of all, you probably find it uncomfortable, but also you could be irritating, you could be doing damage to your new knee joint, okay? Now, why is it so? Is because when you're doing deep squats, the way the biomechanics of your knee works is that you're putting excessive amount of strain on the new knee joint, and that it wears it out, but also it actually makes it hurt possibly for days after you do your workout. So you try to avoid it. And the third type of exercise you should be, at the very least, should be very cautious with is leg or knee extensions. Now, I want to be very clear here. So knee extension is usually when you sit and you possibly attach some kind of load on your shin, and then you extend your leg out, okay? So you may be given this exercise even early in your rehab, and it's fine as long as resistance is quite light. So sometimes the physio will advise you to put a rubber band around your ankle and do these kind of like knee extensions, and that's fine. But when you get to the gym and you get onto a leg extension machine and you put a lot of weight, you put a lot of resistance on your ankle, this is when things can go really wrong. Why? Because this leg extension exercise puts a lot of shearing forces on the knee joint. And because your new knee joint, it's not as stable, it's not as strong as your natural knee joint, that shearing inside the knee joint will can actually cause quite a bit of damage. And again, it can cause increased wear and tear. And over the years, it just may not last as long as it should.
So that's our exercises. 3 you can do, 3 you can't, all right? And like, yeah, I mean, let us know what sort of knee pain you're experiencing or what you're doing in the gym. Leave us know in the comments. But also, again, if you want a copy of that free guide, comment knees down below. Now, we're going to leave a video in the top left-hand corner, which we think you will like. So head over to that video and we'll see you very shortly.